So I'm really looking forward to the next section as we dig into some of those aspects, including around the care economy, which leads me to introduce our next speaker, who I think will lead the next panel, Julie Kashen. Julie is the director of the Women's Economic and Justice work at the Century Foundation, where she is also a senior fellow. She brings more than 2 decades of experience in childcare and pre-K, work in family, economic mobility, and labor issues. So welcome, Julie.
Hi, I'm Julie Kashen. It's so nice to be with you all. So take a moment to think about who you care for and who cares for you. At some point, every one of us will need care or need to provide care. But as Joelle and Anawadia and others have already said, for too long, we've left families shouldering the responsibilities of caregiving and working, taking double and triple shifts without common sense solutions like paid family and medical leave, paid sick days, affordable high-quality childcare, and home and community-based services. As sociologist Jessica Kalerko wrote, other countries have safety nets. The United States has women. We need a publicly funded system that recognizes care as both an individual and social responsibility, that values and better compensates care workers, and supports family members to both care and provide financially for each other. And it's not just common sense, it's a policy win for all. It's good for the economy, it's good for families, it's good for communities, it's good for the people who need the care, it's good for the people who provide the care. It is good for everyone. And it is the pathway to gender and racial equity, which is why some in power are fighting so hard against it. But luckily, there's a lot of forces for good who are powerful and fighting for it. And many of them are sitting next to me right now. So I'm very happy to be joined by Leslie Frayne, Executive Vice President at SEIU, if you want to raise your hand. Haeyoung Yoon, Senior Policy Director at the National Domestic Workers Alliance. Sarah Jimenez, a Senior Researcher with Community Labor United and lead organizer, who brought her fan club for the Care That Works Coalition. Martine Gordon, Senior Advisor for Early Childhood Development at the Administration for Children and Families, and Ingrid Mesquita, Director of the San Francisco Department of Early Childhood. Powerful group right here. So let's start with you, Leslie. SEIU organizes both childcare and home care workers. Can you talk a little bit about the job quality for those workers before you organize them, and what you're fighting for, and what equity would look like?
Sure, that's a great question. And I want to start by thanking you for facilitating this discussion, and thanks to the Department of Labor Women's Bureau for hosting us today. As Julie said, I'm Leslie Frayne, Executive Vice President of the Service Employees International Union, and I'm really proud to be here on behalf of 2 million service and care workers in SEIU in the fight for 15 in a union. And I'm especially thrilled to be here joining this panel of amazing women, all of whom have worked tirelessly to champion the rights of care workers. And we all do this work because we know that the care economy makes all other work possible. Care workers keep our kids safe when we go to work. They support people with disabilities so they can live independently at home. They allow seniors to age with dignity in the setting of their choice. But shamefully, although the majority women of color care workforce provides for those we love most, we pay them the least. The average home care worker in the US earns less than $15 an hour and less than $22,000 a year. 40% of home care workers live below the poverty line, and 43% depend on public assistance to meet their basic needs. It's not right, and it's not sustainable. And that really takes us back to your question, Julie. And the question I would pose is, how can we transform care jobs into good jobs? Which I would argue starts with giving essential care workers a voice on the job through a union. Because when workers come together and act collectively, real change is possible. Just to give some examples, earlier this month, 2,000 nursing home workers in Pennsylvania went on strike for a week. And as a direct result, They won wage increases, safe staffing commitments, more affordable health care, and more. In Nevada earlier this year, union home care workers fought for and won legislation that created an innovative state standards board. And that board is empowered to investigate working conditions in the home care sector. Workers will have a seat at the table to, along with other stakeholders, make recommendations about wages, health care, sick days, training, and explicitly they're tasked with recommendations about how to address racism and gender-based discrimination. But for me, the best way to understand how unions transform home care jobs into good jobs is through the story of Seattle home care worker and SEIU member Brittany Williams and her mom, Danielle. Brittany is a third-generation home care worker. And as a result of hard work by Brittany, her coworkers, and her union, Washington home care workers now start at $17.11 an hour. They have paid leave, they have affordable health care, they have a retirement plan, and they have guaranteed raises every 6 months. But Brittany is painfully aware that her mom, Danielle, who is a home care worker in Arkansas, works 7 days a week and is paid almost exactly half of Brittany's wages. Danielle earns just $9 an hour. Why are Danielle and Brittany's stories so different? Well, it's pretty simple. Brittany's part of a union, and Danielle is not. Now, Danielle would join a union in a minute if she could, but the laws that purport to give workers the right to join unions are so broken that for practical purposes, workers, especially workers in red states, can't organize at all. It's worth reminding ourselves that domestic workers, like agricultural workers, were explicitly excluded from New Deal era labor laws because Southern Democrats were clear that they wouldn't vote for those laws if they covered these predominantly black workforces. Many home care workers are still treated as independent contractors or as quasi-public employees, which means they're excluded from all federal labor rights and only have rights if individual states pass special laws covering them. And as you can imagine, some states do that and many states do not. And while home care workers who work for private agencies are technically covered by the National Labor Relations Act, they have to contend with anti-union employer conduct, which for practical purposes precludes unionization for most of them. We need to unrig the rules so that all care providers, regardless of the color of their skin or where they live, have the right to join unions and win the kinds of conditions that Brittany Williams and her coworkers currently enjoy. But we also need a robust federal investment in home care to transform jobs and to meet the deepening care crisis in this country. By 2028, we will need to fill an estimated 4.7 million home care jobs. And as we all know, our population is aging. 10,000 Americans turn 65 every day, and the clock is ticking. The longer we delay in investing in our care economy, the more workers leave their jobs because, frankly, they simply can't afford to stay in this sector. Earlier this year, Congress passed an important investment in physical infrastructure, which created good jobs for construction workers across the country. They also debated an unprecedented investment in long-term care. But as I think we all know, that investment was carved out of the bill that ultimately became the Inflation Reduction Act. To be clear, SEIU supported the Infrastructure Act. It was a necessary and very important piece of legislation. But I confess that we can't help asking a really painful question. Is it a coincidence that Congress passed the law that funded good physical infrastructure jobs that are mostly filled by men, while the investment in life-sustaining care jobs done mostly by women of color got left on the cutting room floor? With the nationwide care crisis worsening, the need to act has never been more urgent. And that's why SEIU members and our many allies and partners, some of whom are represented on this panel, won't back down in our demands for a major investment in home and community-based care. That will take dollars, but it will also take policy changes. Medicaid funding should be made contingent on states establishing a process to set fair wage and benefit rates for workers. And that process must include a direct voice for the workers who provide the care every day. States should be required to provide training for home care workers, which will enhance both care and job quality. And the federal government should demand that employers who receive Medicaid dollars provide workers with a real path to joining a union. The 800,000 home care workers in SEIU will continue to organize and to fight until every home care worker in this country has family-sustaining wages, paid sick leave, and a union. We'll keep marching in the streets for an equitable future and a voice in our democracy. Inaction is really not an option because seniors, people with disabilities, working families, and our communities deserve nothing less.
Thank you, Leslie. Brittany and Danielle's story is such a compelling vision of the union difference that it could make. And I think a lot of folks have an answer to your question about whether it was a coincidence that Congress passed jobs that will mostly go to men and left women of color behind. Was it a coincidence? Thank you. With that, I'm going to go to Haeyoung. Haeyoung, the National Domestic Workers Alliance organizes home care workers, nannies, and house cleaners for respect, recognition, and earning their rights. You've had a lot of successes in states with domestic workers' bills of rights, and we're part of the successful fight that Leslie mentioned for COVID relief funding for HCBS, for home and community-based services, in the American Rescue Plan. So can you talk to us about what's important about public investments in HCBS, and can you share what's significant about the COVID relief funds and how they're helping workers?
Thank you, Julie, and it's really exciting to be in this room. But I also want to begin by joining the chorus of deep gratitude to Wendy Chanoon and the rest of the Women's Bureau for bringing us together. This is the second time that I'm in this great hall, and for us to talk about equity is super, super exciting, so thank you. Again, I'm Haeyoung Yoon. I'm the Senior Policy Director at the National Domestic Workers Alliance. We organize 2.2 million domestic workers who work as nannies, house cleaners, and home care workers in private homes. And it's been, although we were left on the cutting floor for not included in Inflation Reduction Act, it's been so amazing to partner with SEIU to really push for investment in care. And I think one of the best parts of, there were many highlights in that campaign, but I think one of the best parts is when our workers came together and showed up on the Capitol Hills, really mobilized and really speaking up for why this investment is important. So to your question about why public investment is important, I want to begin by quoting one of our beloved champion of investment in home and community-based services, Senator Bob Casey from Pennsylvania. I heard him on an interview once where he said, many people need bridges to go to work, right? Just like bridges to work are needed for people to go and grow the economy, many workers and their families need caregiving in their home for them to go to work. And so he was saying, caregiving for many workers is a bridge to work, right? And that we really needed that investment. And so why we need this investment, as Leslie talked about, both the enormous caregiving demand and what is happening on the labor side. So I want to spend a little bit more time drilling down on that. Caregiving and the need for care workers in this country is exploding, right? Leslie said 10,000 people turn 65 every day, right? So over 80 million people will be turning 65 come 2040. Right? And it's estimated about 70% of those who turn 65 will need some kind of long-term care. So it's no accident that because of this enormous caregiving demand, home care jobs is also exploding. It is going to be, by 2030, home care jobs, and I'm going to repeat this a couple of times, is the single occupation that will be adding the most new jobs in our economy, right? By 2030, we're gonna need over 1 million new home care jobs, in addition to 4.7 million jobs that need to be filled to meet their caregiving need, right? So this demand is just exploding, right? But we have a crisis on the labor side, right? As Leslie talked about, that workers are earning poverty wages, limited benefits, isolation. So this is creating a crisis where there is enormous amount of worker shortages across the country, right? Right now, especially in this tight labor market. The worker shortages existed before the pandemic. 1 out of 5 home care workers thought about finding a new job because it was such low wages and poor job quality, right? So we have this situation right now where demand is enormous, and the labor is worker shortages because lack of good jobs, low wages, limited benefits, and job quality. So where does public investment fit in? Right now we have a system, care economy, where Medicaid is the largest payer of caregiving jobs in our country, right? So Medicaid as the largest payer of home and community-based services, 73% of $123 billion of home care industry revenue is publicly funded, right? So think about it. Where do we need to lean in to really boost up this care economy is public investment. And there's always a long wait list for people to get on Medicaid's home and community-based services to get their caregiving they need. So as we've talked about, COVID relief funds and American Rescue Plan was a real opportunity. It was a real game changer in really beginning to shift the dynamics in the care economy. So as Julie also talked about, Leslie talked about, the American Rescue Plan invested about $12 billion into this program, right? It's a time-limited, states have until 2025 to invest, but it was a game changer investment because what we see across the country is all 50 states, including Washington, D.C., took this money to invest in expanding and strengthening the system at the state level, right? And about 46 states are using that money to improve wages and working conditions for home care workers. 18 states are providing temporary wage increases, right? And 12 states took this money and decided that they're gonna raise the wages permanently. It'll be interesting to note that of those 12, obviously there are states like Washington where SEIU has done tremendous work, Colorado, Illinois, but also Florida, North Carolina, Alabama, Georgia, joining the set of states to raise wages for workers on a permanent basis, right? So this initial investment is a real opportunity for us to build a robust care economy that Julie talked about. So Medicaid as the largest payer, the investment has started, right? We're gonna need to continue to invest in this program to really make sure that we meet as a country this enormous caregiving need that we face, and that workers who do that work day in, day out, right, are treated with dignity and respect and fair compensation.
Thank you so much, Haeyoung. And I suspect that as Leslie and Haeyoung were talking, that Martine and Ingrid and Sarah are also hearing very similar stories for what's happening in childcare right now. And so I'm going to turn over to Sarah. The Care That Works pilot program that you organize, it helps to bridge the gap between childcare and the construction trades. And this is an issue that is clearly a problem that Sarah Jane had talked about and Ariana talked about, right? And so would love to hear about the program that you work on and how you leverage public dollars to support workers and the program itself.
Thank you, Julie. And just thank you everyone so much for being here. I have been really vibing with the energy in the room today. It's so great. My name is Sarah Jimenez. I'm here for the Care That Works Coalition. We are a multiracial feminist coalition working for an equitable care future. Our Care That Works pilot is a demonstration program to invest in women of color as childcare providers so that they can provide the childcare for mothers of color to enter Boston's unionized building trades, particularly through Building Pathways, which is the top trades pre-apprenticeship program in Massachusetts, and obviously well represented here today. So these are some of the top paying jobs that you can get in Boston that don't require a college degree, but you have to be on site at 5:45 or even earlier, and most childcare programs don't open until 6 or later. So that early hour care is a major support for parents to pursue these careers, especially single parents, many of whom in Boston are single Black and brown mothers in poverty. So as prompted, I'm going to talk about how we're funded, and then also how we deploy that funding through equity-driven design. So over time, we've put together 6 different types of funding. In total, we hope to hit 1.3 million before the end of this year. There are 3 types of private funding. So first, through our close partnership with the building trades, some of our earliest grants came directly from individual trades unions who are really committed to this mission. Also through union partners early on, we were able to get funds through 2 project labor agreements that were negotiated on some of the large developments going up in our city. And then third, after operating for a little while with a bit of a better track record, we were able to secure a more traditional foundation grant. We also have 2 public grants and then a third one in the works. All 3 of them are through the city of Boston. One was through our city's Office of Women's Advancement. So this was a relatively new office, and our coalition engaged with them early on to encourage them to focus on childcare specifically. So when they requested grant proposals to build a supply of childcare in the city, we were able to secure some of those. A second grant was jointly offered by that same office and also our city's Planning and Development Agency. And the backstory on that one is that years ago, we learned of a requirement in our zoning code for certain developers to either build childcare facilities or contribute to a childcare fund. In our code, it's called the Inclusion of Daycare Facilities, established in the late 80s. So we learned there were actually funds that had been collected and then never allocated, so we got some of those as well. And on top of that, Mayor Wu is now working to strengthen and expand that zoning requirement. So we're excited that the city will soon have even more childcare resources to work with. And then third and most recently, we applied for funding from our city's brand new Office of Early Childhood. Earlier this year, Mayor Wu and the City Council passed a spending package that was funded by the ARPA state and local fiscal recovery funds. So we worked closely with Councilor Julia Mejia to include $1 million to fund childcare for non-standard schedules. So that was just put out to grant last month. We're crossing our fingers right now. So that's all the funding. Now to the program and how it works. Very simply, we get the word out, parents contact us, we match them with a provider, we give the provider a stipend. So on the face, straightforward. But of course, what keeps us up is the work to design and redesign everything to best center low-income women of color as both the parents and the providers. So we beta launched this 2 years ago at a small scale, and we work with outside evaluators to capture key lessons toward that end. One lesson for parents is that to reach those hardest to reach parents, we really, really depend on the partners who have deep and trusted relationships in those marginalized communities. For example, Brookview House that serves families transitioning from homelessness. As you heard from Ariana and Leah on the other panel, these moms have never had anyone tell them that you would be a great carpenter or you would be a great electrician. And it really helps to have someone who says it and then sticks around to say it again and again as many times as it takes. We also quickly learned that for parents, coordination through this program is full-time work, even at a small scale. These parents really benefit from regular and frequent touch points and encouragement as they navigate the many stages that you go through on a training pathway. And then so relatedly, we have found the need to design a flexible youth scholarship for our program for the parents. And unfortunately, it can't cover the full cost of care, but it can offset costs temporarily, and it can serve in emergencies if they arise. And we learned that they definitely do arise. For providers, first of all, our model is built around home-based providers. because even within the care workforce, they are disproportionately Black, brown, and immigrant women, because they are severely under-resourced, and because they are embedded in the same communities as the parents that we want to reach. So many providers are highly motivated to help their neighbors, women supporting women. Many already do as much as they can, even without the compensation, and even at a net cost to themselves. These are the women that we want to recognize and resource in our program. So we work with SEIU Local 509 to identify childcare providers. The monthly stipend is a supplement on top of what the parent pays. It doesn't make care a good job, but it makes it a bit better. One key lesson for providers that we've learned is how crucial assistants are for providers to make those early hours work. And right now, as with so many other jobs, it's really difficult to find assistants. So that brings me to one of the biggest priorities that we have right now, moving forward into our next phase, being led by our wonderful community partner, New England United for Justice. We need to build a pipeline that interlocks with that parent pipeline into the trades that is focused on workforce development for home-based assistants and providers. This needs to be a development pathway that's designed for Black and brown and immigrant women who already are providing care but are not paid for it. Communities that we think of as childcare deserts are full of these informal caregivers. So the pipeline will, of course, help build the size and capacity of our pilots provider network. But even more importantly, we see this as an opportunity to model an equitable and an even reparative approach to childcare workforce development, so that when we win fuller funding for childcare and we make those care jobs into good jobs, we can ensure that women of color are not left out again. So that's where we are. I'm really grateful to share what Care That Works has done and learned. With a historic opportunity like the one we face now, I am really heartened to be in conversation in this room with folks today who know that the work ahead of us must be not only fast, but also just. Thank you.
Thank you, Sarah. I don't know if y'all noticed that at the end she said, when we win the funding. Yes, when we win the funding. And here to talk a little bit about when we did win some of that funding is Martine. The work of childcare providers and advocates and parents and child development experts around the country helped the American Rescue Plan to include significant funding, $40 billion for childcare and early learning. Martine is at the Administration for Children and Families that has been administering and implementing those funds to make sure that the childcare sector was stabilized during the pandemic. Already it was falling apart before, it was not already in good shape, but the pandemic really drove its Mack truck over it, and so those funds helped to put some Band-Aids together, I'm mixing my metaphors, and also the Department of Health and Human Services recently put out some sub-regulatory action around compensation for childcare workers. So Martine, I'd really like to hear about both of those things.
I'm very happy to talk about them, thank you. I'll just frame a little bit. The Administration for Children and Families at the Department of Health and Human Services, we effectively are the human services arm. And a key critical priority for us right now is supporting the human services workforce more broadly. And our team working on childcare and early childhood matters at ACF, we have really been setting the pace for centering the needs of the early childhood workforce in those conversations, in partnership with our federal colleagues at the Women's Bureau, and others. So we're very happy to and honored to house the Office of Child Care that had the privilege of distributing the $40 billion in child care emergency assistance included in the American Rescue Plan. And I'll talk a little bit about what that has looked like and what we hope that looks like going forward. And then I'll go into some of the other things we're doing. So the money included a $29 billion emergency stabilization funds, which we have been working with states, tribes, territories to get out the door into the hands of folks who need it. That money can be used for things, and has been used for things like rent, utilities, like literally keeping the lights on for childcare providers. It's also able to be used for goods and services. It's also able to be used for personnel expenses. And the vast majority of providers who have received those funds have used them for personnel expenses, that we know. I think there's to date, I think there's something like 650,000 grants that have been distributed across the country to more than 200,000 providers across the country, that have a capacity to serve more than 9 million children. So we're talking about a pretty extensive reach so far. Those numbers keep ticking up. There's still money going out the door. That was sort of the first big push. Now coming out, there is what is called, I'm losing my S words. Stabilization, supplemental funding, thank you. The first one was stabilization funding, now we're getting into supplemental funding. It's not as big of a chunk of money, but that is coming out on the heels of the initial stabilization push. And so states, territories, tribes, they're able to start accessing that funding now, and we're working with those grantee partners at the federal level. Our grantees are the states, the territories, and the tribes themselves, to help make that money flow quickly and hopefully in sustainable ways. We actually have a colleague here, Kim Burgess-Sims, today. She's going to be doing a breakout session workshop later that's going to be talking about some of the things that states and localities are doing. So if you're interested in that, and not just using these dollars, but also how they're using these dollars to leverage existing dollars. We've talked about, some folks on the panels this morning have talked about how we're leveraging dollars across different funding streams. So if you're interested in that, please check out Kim's session. So that's really where we're focused right now, helping the states, the tribes, and territories get that money out quickly. And also just where we can be creative. And that's where the suite of guidance that we released last week comes into play. So we've been really thinking creatively about, with the existing money that is there, with the existing policy and regulations that are there, where we can make it clear where there's flexibilities, where grantees can move. And so there was some guidance that was released from the Office of Child Care on how funding can be used, and examples of how funding has been used by states and jurisdictions to increase compensation for the child care workforce. There was also a guidance released by the Office of Head Start last week that similarly talks about using Head Start dollars in allowable existing ways to help increase Head Start employee compensation. And we also had an additional piece of guidance from our preschool development grant Birth Through 5 team. So for states and territories who are recipients of those dollars, you should check that out as well. I also would be remiss if I didn't highlight some things that we're trying to do until there is additional congressional investment action. I know that federal work can seem a little clunky compared to some other work, but we do try to be creative sometimes. And this is one instance where we're really dedicated to making sure that we are clear where there are opportunities to leverage different funding streams, make that clear to folks on the ground. So we are very pleased that in addition to the guidance last week, we announced new preschool development grant Birth Through 5 funding opportunities that are, I believe, are on grants.gov right now. So if states and territories, please check your eligibility. There's a 1-year planning grant opportunity. There's also a 3-year renewal grant opportunity for those that are eligible. And then we also announced a new opportunity. And this is one where our teams came together across programs and across different types of funding stream to really think about how we can support the early care and education workforce right now. So it's a new opportunity that will create a national early care and education workforce center. And what this does, and why we're so excited about it, is because it takes existing funding streams that were sort of dispersed across our program areas, and it puts it in one place. And it says we're gonna have this workforce center, and it's gonna do research. It's gonna provide technical assistance across states and local jurisdictions. And that research and that technical assistance are going to inform one another, and they're going to form our policies going forward. So that's an opportunity that's out there right now, and again, an example of how, we're trying to be less clunky. We're trying to open up, just open up opportunities to be able to create this vision for an early childhood sector that we see, that we want to see in this country, and that for Administration of Children and Families is one that meets the developmental needs of kids and their families in their communities where they are today. And we know that that absolutely depends on a well-qualified and well-compensated workforce to lend stability to the field. So I'm gonna stop there. That's just some stuff about what we're doing now, but we're absolutely happy to be on this panel and happy to continue to partner with the Women's Bureau and other federal partners going forward.
Thank you so much, Martine. Now we're gonna move from the creative, crucial, and clunky federal level to the local level. Let's hear from you, Ingrid. You're the director of the Office of Early Care and Education in San Francisco with a focus on equity and systems change. What are you seeing right now? We're hearing tons about the childcare staffing shortages. What's happening on the ground, and how are public dollars helping, and what else would make a big difference for you?
Good morning. Wow, this is a historical moment to be able to be in the Women's Bureau and being able to speak about these issues, because in San Francisco it feels like we've been very alone in these conversations, and it just sort of really highlights and amplifies the need to be able to invest in a workforce that everyone else has already commented about. And at the very local micro level, because San Francisco is small, we're 7 by 7 sort of square miles, 49 square miles. We have a small child population in comparison to other urban places across the country. For children birth to 5, we have around 45,000 children, which is not a lot. And that is because we're one of the most expensive cities to live in. And several years ago, and this goes actually even predates maybe 3 or 4 years ago, even when we had Vice President Harris as our city attorney and then district attorney, we implemented a universal preschool system back in 2005. And even then, we saw what the need was around building not only the infrastructure for birth to 5, in terms of early care and education, but also the need to be able to build the pipeline, the workforce, the ability for women, especially women of color, to be able to have those educational opportunities, but also economic mobility. And so in 2018, and very many thanks, I'm gonna shout out to 2 county supervisors who really helped spearhead this proposition, a local proposition that taxed gross receipts tax and also property commercial tax, commercial leases. And that was Supervisor Norman Yee and Supervisor Jane Kim, who brought this forward and actually we're able to now collect $120 million a year from those fees assessed. From the $120 million, we're setting aside $70 million to really support the workforce in terms of the early care and education field. And in many ways, one, to raise a minimum compensation for people who are working in early care and education to $28 an hour. That's minimum, period. And then from there, building it up to be able to be at parity with our school district for people who are working in K to 12, and that means in everything, not only in salary, but also in benefits. We, as I speak right now, the ink is drying on a lot of those grants that we are extending to all the nonprofits that have not only the workforce in early care and education, but also the people who support them too. And one of the things that we looked at is, in order to create equity, right, educational equity, we also have to create the equity and those opportunities for the people in this care system that support children and families every day. And for many, many years, what we've done is we've expanded this care sort of economy, but really on the backs of women and women of color, by having them subsidize the subsidy that they receive from not only, and I'm sorry, I know I'm in a federal sort of holy land here, but from the, from the feds and also from the state. When we look at the child care reimbursement rates, these are very, very low, especially one, to be able to hire people who have the skills, the training, the education experience, but also to be sustainable, especially in places like San Francisco, and be able to say that this is dignified work. Of course it is, but we don't value it in that way. We look at it as something like it's a benefit to the family, when in fact this is about life course. The people who care for our children birth to 5 are the ones who are impacting the most that development of children. And if anything has proven now, empirical evidence now, is that brain development happens within the first 3 years of a child's life. Language, cognitive, executive functioning, empathy, all of that is developed. And yet when we undervalue the people who actually support that development, then we're actually undervaluing the society for which we're trying to build. And so through the Baby Prop C, which we lovingly call it now, we are putting minimum standards in terms of compensation and also working conditions. Because that's the other thing. People work 10, 12 hours a day in this industry, in this sector, and that shouldn't be so. We have to be able to look at ways of people's benefits and the way of how they create economic mobility for themselves and for their families. Because as we want to rise up and make sure that children are arriving at kindergarten ready, that means that we have to create this infrastructure that supports the women, who, by the way, it's 90% women, and of that in San Francisco, it's 85% women of color. And so with that, this is the investment that we're making long-term. It's funding that we're able to collect now on an annual basis. We're being able to build childcare spaces. We're able to create scholarships and other support systems for women who want to enter into early care and education field. So again, they have the economic mobility, but also the professional mobility to be able to look at this long-term, again, as a career, as a way of being able to value their contributions towards, again, the life course of children, especially children of color in our city.
Thank you so much. We have just a few minutes left. I want to just quickly note that, the care infrastructure, the care economy is not complete if we don't also think about the ways that paid family and medical leave plays a role in, people being able to take time that is paid to care for their loved ones. And so I think, we all see how essential that is looped into all of this. In our last few minutes, I'm just going to ask you to say kind of 1 or 2 sentences on, if it could be different, if it looked different, what would it look like? What is your dream for the care work to look like? And Ingrid, can I start with you?
Sure. I think the way that I would love for it to look like is that you have a universal childcare system that really underscores where that care is being provided. And that we look at it in a way of human development, and that supports that through not only a whole child approach, but also looking at the people who make up that system, through, again, through a dignified way that means wages, benefits, and every kind of quality of life that supports a just society.
Thanks. You want to go down the line? Go ahead, Leslie.
So I think to answer that question, I'm going to go back to Danielle and Brittany Williams. And I told you that Brittany was a third-generation care provider in her family, but I asked her once about her own kids, and she said to me, yeah, but I don't want my kids to be the fourth generation of care providers. I want better for them. And so I would say if we can fix this broken system, then Brittany will want her children to be care providers too.
So we at the National Domestic Workers Alliance have this vision. By 2030, we want every single domestic worker to earn a living wage and have access to benefits. So we want to get there. Along the way, we want to make sure everyone who needs the basic critical services and care, right, to have access to that, right? And so it's going back to the original vision when we started calling for a care economy this time around, right, as a part of President Biden's economic agenda, that we want to make sure that every person who needs that service has access to it, and every worker who provides it has a living wage, voice, and benefits, and that at the end of the day, it is about building an equitable and inclusive economy and society, because the workers who do this work are largely women, largely immigrant, and women of color.
I know we're at time, so I'm going to actually cede my time to Sarah so I don't hold us over, but I'm generally ditto.
Thank you, Martine. I would love to see us create a society where the reproductive labor in our communities is a formalized industry like any other, that is grounded by the people who do the work and receive the work, the people who are cared for and people who are caring for one another.
Thank you. Thank you all. Thank you, Wendy. Thank you, Patricia. Let's make care the public good that it is. Thanks, Wendy.